What if I told you that the person who had a stroke yesterday actually had every warning sign the day before and didn't know it? What if the headache they called just stress was their brain screaming for help? What if the blurry vision that lasted 30 seconds was the last warning their body would ever give them gently? Dr. Waterling, a neurovascular specialist who has spent over 2 decades studying the hours before a stroke strikes, sat across from hundreds of survivors and asked them one simple question. Did anything feel different the day before? And every single time, almost every single time, the answer was yes. They felt something. They noticed something, but they didn't know what they were looking at. That is exactly what we are here to change today. Because the difference between a stroke that destroys a life and a stroke that never gets the chance to is knowledge. The knowledge of what is happening inside your body in the quiet hours before the emergency. Stay with me, because what you are about to hear could one day be the most important thing you ever listen to. Silent warning signs appear. Up to 24 hours before a stroke rarely arrives without warning. Subtle signs like sudden dizziness, brief confusion, or a fleeting numbness on one side of the body can appear the day before and are almost always dismissed as tiredness or stress. TIA, the mini-stroke, is the loudest warning. You'll ignore. A transient ischemic attack, TIA, mimics a full stroke but resolves within minutes. Most people feel relieved and move on. Medical professionals call it a stroke rehearsal. And 40% of TIA patients suffer a major stroke within 48 hours. The brain signals, through the body. Sudden vision changes in one eye, slurred speech lasting seconds, or a one-sided face droop that came and went are the brain's emergency broadcasts. The body speaks, most people simply don't understand the language. Time is brain. Every minute costs 1.9 million neurons. Medical science confirms that every minute a stroke goes untreated, nearly 2 million brain cells die. Early recognition doesn't just save quality of life, it saves the brain itself. Blood pressure spikes the night before are a red flag. Studies show a significant number of stroke victims experienced a measurable, unusual blood pressure spike the evening before the event, often during sleep. Most had no monitoring in place. 6. The FAST formula is the difference between life and death. Face drooping, arm weakness, speech difficulty, time to call emergency services. Knowing and acting on this acronym within the first hour dramatically increases survival and recovery odds. What if your body was sending you a warning, a real biological measurable warning, and you spent that entire day calling it nothing? This is not a hypothetical. This is the story of millions of people around the world every single year. A stroke does not simply arrive without announcement. It knocks, it whispers, it shouts through symptoms that feel ordinary. Symptoms that feel manageable, symptoms that feel like they will pass, and often do, which is exactly what makes them so dangerously deceptive. Dr. Waterling describes the human brain as the most honest organ in the body. It does not lie. It does not panic unnecessarily. When blood flow is being compromised, when a clot is forming, when a vessel is under dangerous pressure, the brain communicates this through the body. The tragedy, Dr. Waterling has said again and again in his research, is not that people ignore these signs out of laziness. The tragedy is that they ignore them out of ignorance. They simply do not know what the signs mean. So what does a stroke look like the day before it hits? It looks like waking up with a headache that feels slightly different from your usual headaches, not necessarily more painful, but somehow deeper, more located behind one eye or at the very base of the skull. You take a painkiller, you move on. That is what it looks like. It looks like a moment, sometimes only 20 or 30 seconds, where your vision in one eye goes dark or blurry, or as though someone pulled a curtain halfway across your field of sight. And then it clears, and you think, strange, but you move on. It looks like picking up your coffee cup and noticing, just for a moment, that your grip on one side felt slightly weaker than the other. You shake your hand out. You move on. It looks like saying something to a family member and stumbling over a word, not from tiredness, not from distraction, but from a half second where your mouth simply did not obey your mind. You laugh it off. You move on. Dr. Waterling calls these moments grace windows. He believes, and his research strongly supports, that the body gives most stroke patients a grace window of 12 to 24 hours, a window of time in which intervention is not just possible, but potentially life-saving, a window that, tragically, most people never even realize is open. The medical term for what many people experience in this window is a transient ischemic attack. a TIA. It is sometimes called a mini stroke. And that name, while well-intentioned, has done enormous damage. Because when people hear mini, they hear minor. They hear not a real problem. They hear it passed, so I am fine. Dr. Waterling has publicly argued that the term mini-stroke should be replaced entirely because there is nothing minor about it. A TIA is a stroke that stopped. It is the brain surviving an attack and recovering, but it is also a flare sent up into the sky, a biological alarm going off at full volume telling you with absolute certainty something is wrong and it will likely happen again, and next time it may not stop. Statistics are not just numbers on a page, they are human lives translated into data, and the data tells us that nearly 40% of people who experience a TIA and do not seek medical attention will suffer a full stroke within 48 hours, 40% within 2 days, and yet the majority of TIA patients do not go to a hospital because they felt better, because the symptoms passed, because they did not know what they were holding in their hands. Dr. Waterling once shared the case of a woman, a retired school teacher, who came to his clinic 6 weeks after a major stroke had left her with significant paralysis on her left side. As he reviewed her history, he asked her about the days leading up to the event. She paused, she thought, and then she said, "You know, the evening before I was sitting watching television, and my face went numb for about a minute, just the left side. I thought I had been sitting in a funny position." She had been watching television. She had a 1-minute warning, and neither she nor anyone around her recognized it for what it was. This is not a story of failure. This is a story of a gap between what the medical community knows and what the general public has been taught. And the purpose of everything being shared with you today is to begin to close that gap, because knowledge at this level is not academic, it is survival. The signs to remember are not complicated. They are not obscure medical terminology that requires a degree to understand. A sudden severe headache with no clear cause, especially one that feels different from any headache you have had before, is a warning. Sudden confusion, difficulty understanding what someone is saying to you, a momentary blankness is a warning. Any weakness, numbness, or unusual sensation running down one side of your body, arm, leg, face, is a warning. Sudden trouble seeing from one or both eyes is a warning. Sudden loss of balance, dizziness, difficulty walking is a warning. And the formula that medical professionals around the world want embedded in every human mind is this: fast. Face. Is one side drooping? Arms can both be raised equally. Speech. Is it slurred or strange? Time. Call emergency services immediately, without hesitation, without waiting to see if it passes. Dr. Waterling has said that the single most powerful piece of medical advice he could offer to any non-medical person on the planet is this: do not wait. When the body speaks these words, the correct response is never, "let me sleep on it." The correct response is action. Immediate, unashamed, unapologetic action. Because inside the human brain, every single minute without blood flow destroys approximately 1.9 million neurons. The brain does not have the luxury of time, and neither do you. There is something else that research has brought to light, something that is not discussed enough in everyday conversation: blood pressure. In a significant number of stroke patients, their blood pressure rose to dangerous levels the evening or night before their stroke, often while they were asleep. Many of them had no monitoring in place. Many of them had a history of high blood pressure that they managed inconsistently. Dr. Waterling's position on this is unambiguous. If you have high blood pressure, if someone in your family has had a stroke, if you are above the age of 45, you should know your blood pressure numbers the way you know your own phone number, because those numbers are telling you your story every day. You simply have to read them. The people sitting in this room today, the people watching, the people listening, you now know something that too many people go their entire lives without knowing. You know that strokes announce themselves. You know what that announcement sounds like. You know the formula that can turn a potential catastrophe into a medical intervention that saves a life completely. Share this. Tell the people around you. Tell your parents, your siblings, your friends, your coworkers. Put the word FAST somewhere visible in your home. Check your blood pressure regularly. And if you ever feel one of these signs, even for 30 seconds, even if it passes and you feel completely normal, you go. You call. You do not wait. Because the stroke that sends a warning is the one that can be stopped. What a stroke looks like the day before it hits is not invisible. It speaks through headaches that feel different, through vision that flickers, through hands that hesitate, through words that stumble for just a moment. The tragedy of stroke is not that the body gives no warning. It is that the warning goes unrecognized. The brain gives most people a window, a grace window. And what you do in that window, whether you recognize it, whether you act on it, whether you get to a doctor in time, determines everything. You now carry knowledge that is genuinely life-saving. Not metaphorically, literally. Knowledge of this kind, shared widely enough, changes outcomes. It changes survival rates. It brings people back to their families whole. Take this with you. Act on it. Share it. Thank you deeply and sincerely for giving your time and attention to something that truly matters. This information exists to protect you and the people you love. Carry it with you, share it freely, and never underestimate the power of knowing something at the right moment. Good luck, good health, and take care of yourself, because you are worth protecting.